But keeping in that theme, we're going to move on to the second presentation that Jason prepared for us, and focusing on innovations in cattle monitoring. So we've talked a little bit about detection with the whisper. He's going to kind of broaden it a little more with cattle monitoring. So if you just give me a moment, I'll get this started.
Well, once again, good afternoon, good evening. Again, my name is Jason Nickell. I'm a veterinarian with Merck Animal Health and Allflex Livestock Intelligence. For the second discussion here this evening, we're going to be spending that time focusing on the concept of early BRD detection, why that's important, the issues around that, and then some relatively new technology that Merck Animal Health has recently acquired and is currently continuing to develop in order to roll out here early in 2021 for use in that backgrounding, stocker, and feedlot stages of beef production. But we're just going to move right into it. And again, I think you'll see here, as rich as we are regarding data on whisper on arrival, we're early enough in our learnings around the Quantified Ag product that we admittedly haven't had the time to generate as much data. So what we have, I'll be sharing with you here over the next few moments, knowing that we are going to be generating more starting in the coming months, but that also we are learning a lot through our commercial partners as well. So with all that being said, again, take notes, be ready to ask questions, and I'll try to be ready as I can to answer accordingly. So if I can get my slides to advance, hopefully. There we go. A pointer. Taking a step back, the reason, one of the many reasons that BRD continues to be an issue is the fact that the bovine in general is a prey species. This is nothing new. I'm not sharing any earth-shattering data here with you. This is something we recognize, and something not uncharacteristic to other prey species. You know, across the board, we see how prey species protect themselves in a number of different ways. You know, that could be by playing dead, utilizing camouflage, running away, or emitting noxious chemicals to get away from their aggressors. But in the case of the bovine, especially animals that the general, not the aggressive animals, but just the average run-of-the-mill bovine, when this animal's ill, its means of protection is to appear healthy. And I think we've all had the experience where we have observed an animal that is sick from a distance. That animal did not know we were there, or that we were far enough away that it didn't care about us at the time. And you can obviously tell that this animal does not feel well, right? But immediately when you start walking, get closer to the animal, and if you walk into that same area as that animal, that head pops up, and all of a sudden, that animal looks pretty darn healthy, where before it was obvious that it didn't. And so this particular hardwiring of that bovine is what makes diagnosis of BRD so difficult. Okay, and that's what we're going to spend our time on. At the end of the day, as it relates to bovine respiratory disease, we basically have two populations. We have populations that either do have bovine respiratory disease, shown here in black, and those that do not have bovine respiratory disease. Right? However, when it comes time to diagnose that, ultimately what we'd love to have is a test that we could fully separate those two populations apart, find them early in the disease process, get them treated, and be on with our day. Right? But the reality is that we don't currently have that. And we may never be at a point where we have something that is completely accurate. There's just so much biology in this process that it's going to be hard very difficult to show 100% accuracy, as it is so many other things, right? This is no different than that. But at the end of the day, in our current diagnosis, which consists of human detection, generally followed up by a confirmatory rectal temperature, is that these two populations overlap, okay? And so those left in the pen consist of both false negatives and true negatives. False negatives are those animals that truly have bovine respiratory disease, but simply we miss. And we know over the past 25 years of data generation that there is a significant amount of animals that are missed because we see evidence of that in the packing plant, right? We see evidence of animals that have had that have lung damage with no history of bovine respiratory disease, right? And it varies on what the prevalence of that is from study to study, but the multiple authors that have looked at that have found a large prevalence of animals with lung lesions with no history of treatment. Okay. However, those animals that end up getting treated for bovine respiratory disease consist of animals that not only truly have the disease, okay, true positives, but also animals that don't have the disease that we have misclassified and administer expensive antibiotics to, but don't have BRD to begin with. And those are what are called false positives. Okay. Now, again, yes, we're capturing many of the true positives here. But the other thing that we have to keep in mind with these true positives is that we are likely late to the party in many cases. Because that animal is designed to conceal the fact that it's sick, because it is, by the time it does get sick, it is usually several days into the disease process. Okay, so we are in many cases behind the 8 ball to begin with before we actually see that animal ill. And so that brings us to the point of Quantified Ag. Quantified Ag was a startup company located in Lincoln, Nebraska, that Merck Animal Health acquired partial ownership of in 2018, and spent over the last 2 years working with them, helping to develop that technology. And then recently here in the spring of 2020, we fully acquired that business. And so we have since then continued those efforts of ongoing development being both in data generation as well as hardware and software improvements. And we'll talk about that as well. But we plan to roll out Quantified Ag, if not in parallel, soon thereafter, or prior to the Whisper on Arrival technology that we spoke in the prior segment. But the Quantified Ag technology, again, is designed to identify outliers in the population. Most of the time, that being bovine respiratory disease, but it's not specific for BRD, but to identify outliers in the population to be identified as early as possible and addressed as necessary. When we were assessing, back in the early days when we were assessing this technology, we wanted to get some handle as far as what this particular technology can do. And in all fairness, this study was run the better part of 2 years ago. Since that time, there have been a number of leaps and bounds made, both from a software standpoint, but also from a hardware standpoint. And so the data that we see today is, well, for lack of a better term, outdated, because there have been so many improvements. But it's where we're at right now, and we do have plans to continue those efforts going into the future. But the objective of this study was very simple. It was to estimate what the potential value it may be, and as you'll see here, perhaps maybe the theoretical value, in identifying cattle with BRD, utilizing the Quantified Ag technology, compared to traditional BRD diagnostic methods, which included, the pen writer, which includes visual observation followed by rectal temperature. So at the end of the day, what this really means is that we put Quantified Ag tags on animals. We did not act on that data. We just collected that data in the background and allowed these animals to be pulled in a conventional manner. Okay? We'll get into that. But at a high level, the sample population consisted of crossbred beef heifers These animals were procured through multiple auction markets in the southern portions of the U.S. By the study site, they were considered to be high risk, or what they have seen to be high risk in the past. And obviously that body weight was commensurate with their age. We'll talk about that. It was unlike the whisper on arrival studies that we talked about earlier, which occurred at 4 sites. This particular study was performed at one study site at a commercial feed yard in western Kansas. Enrollment criteria reflected populations, again, that were at high risk of developing BRD with no clinical signs of clinical BRD or non-BRD issues, anything that might prevent the animal from not finishing the study. On day 0, again, a very standard processing regimen, especially for heifers, where all the animals received modified live viral vaccine, complete with the Mannheimia hemolytica vaccine as well. They were dewormed. We administered steroid implants to those animals. We aborted all those animals. We administered an individual ID tag to those calves. We grabbed an individual body weight. We administered antimicrobial metaphylaxis to control BRD, and we PI tested all the animals in the study. From a tagging standpoint, these animals, again, like I mentioned, were all observed and pulled as necessary by pen riders, just in a conventional, just like in any typical traditional or conventional manner. But we did equip all these animals with Quantified Ag ear tags to capture all of that biometric data in the background. These animals were housed on open-air dirt floor pens. All the space recommendations followed typical feedlot SOPs. They were fed according to that study site. All those animals received an ionophore, tylosin. Again, being heifers, they received MGA and a beta agonist at about 30 days left on feed. And all that was fed the same across all pens in the study. And we did measure feed consumption. Water was available at all times, but no water medications were available. There was a 5-day post-metaphylactic interval or moratorium after arrival processing and receiving metaphylaxis. Pen riders then, starting on day 5, rode those pens daily. Our case definition was very similar as in our last study, where these animals had to be observed with clinical signs of bovine respiratory disease, and then needed to have a rectal temperature of at least 104 degrees. And again, quantified ag tag data was recorded but not acted upon. The treatment regimen consisted of what you see on the screen here, with the first treatment being new floor, followed by a 3-day PTI. If they got sick again, they received Baytril 100, a second 3-day PTI, and if a third treatment was required, those animals received biomycin 200. As animals met the criteria of potentially needing to be removed, they were removed for animal welfare issues, although we did our best to keep those lots together. If an animal died, we removed that animal from the pen accordingly, and these animals did go to closeout. And at that time of closeout, we did capture not an individual weight, but a pen weight on those animals. Pretty standard set of outcomes that we captured from a health standpoint. We captured BRD morbidity, retreatments, and third treatments, BRD mortality and overall mortality. From a performance standpoint, we captured average daily gain and feed to gain from a deads in and deads out standpoint, and we captured carcass metrics as well. Statistically, in the models that were used, we utilized an alpha of 0.05. Again, the experimental units was the pen, and all the random effects were addressed. Random effects basically being the day of enrollment. A lot of data here, and none of this really impacts this discussion, but I wanted to show this just to give you a profile of what these animals basically look like from start to finish. We started with 1,090 animals spread out into 14 pens. We found no PIs in this group. We did have 2 animals die between day 0 and day 5. And so they were removed, giving us 1,088 animals across these 14 pens. Going forward, at arrival, they averaged roughly 600 pounds. And I won't go through all of this. I'll just point out the highlights. We saw a morbidity risk of roughly 24%, overall mortality of about 4.4%, BRD mortality of 3.1%, and total outs being roughly 4.6%. Okay, so in that probably that lower side of high risk, depending upon whatever your as we talked earlier, whatever your definition of high risk may be. From a closeout performance standpoint, these animals were on feed for 195 days. Their final body weight averaged roughly 1,200 pounds, just a tick under 1,200 pounds. From an average daily gain standpoint, average daily gain, deads in was 2.74, deads out was 2.99. Feed to gain, likewise, was 6.88 and 6.40 from a deads in, deads out standpoint. Okay. Real briefly, we saw an average hot carcass weight of roughly 750 pounds with a dressing percentage of 63.5%. We saw, from a lung score standpoint, which we'll talk about more here in a moment, we saw an average of about 77% normal lung tissue, the rest of that made up with some degree of pathology. We'll talk about that here more in a moment. And the rest of that data you can see here, and we can dig more into that if need be. But what we were looking for here is what would, in a population like this, what is the degree of lung pathology? And as we talked about earlier, knowing that lung pathology inhibits performance, right? And that there's going to be a certain proportion of those animals that exhibit lung pathology that are just going to be missed by that tin writer. In this particular analysis, what we see was that across the board, based on tin writer count, which is on the top here, so animals that were pulled 0 times, 1 time, 2 times, or 3 times, you can see their subsequent hot carcass weights. So those that were never pulled for bovine respiratory disease displayed a hot carcass weight of roughly 764 pounds. This was significantly higher than those that were pulled once. Those that were pulled once were significantly higher by those that were pulled 2 times. And although not statistically different, those that were pulled 2 times still showed about a 25-pound numerical advantage compared to those that were pulled 3 times. So between those animals that were never pulled versus those that were pulled 3 times, there's roughly 120 pounds difference. And so we are leaving 120 pounds on the table by these animals getting sick over and over and over again. Okay. Likewise, from a lung health standpoint, we see lung health decline as well, as you can imagine. And so as lung health declines, so does hot carcass weight. And so in animals that were never pulled, we saw those animals with roughly an average of 82% normal lung tissue. As we move down the scale here from being pulled once, twice, and 3 times, you can see lung health deteriorate as we move from being pulled 1 time down to 3 times. Okay. And ultimately, if that animal is pulled 3 times, there is, at least in this study, was less than 30% normal tissue left in that animal. Okay. If we look at the degree of lung consolidation, okay, shown up here on the top, and the degree of lung consolidation being normal, 5 to 15% affected, 15 to 50% lung tissue affected, or greater than 50% lung tissue affected, we can see that our hot carcass weight is subsequently affected as well. So animals with normal lung tissue displayed hot carcass weights of roughly 770 pounds. As we move down here, that is statistically more than animals with 5 to 15% lung pathology, where they showed roughly 25-pound reduction in hot carcass weight. If animals with lung consolidation up to 50%, there was not a difference between those with 5 to 15% lung consolidation versus those with 15 to 50%. These two are not statistically different, but again, we are losing roughly 25 pounds of hot carcass weight up to this point. Once they go above 50%, and we've seen this in other studies as well, once they hit that tipping point of 50%, of at least 50% pathology, we lose considerably more hot carcass weight. In this case, we lost about 60 pounds of hot carcass weight when lung pathology exceeded 50% in volume. What we saw with regard to the quantified ag tags, what you see here is basically the histogram of when the quantified ag alert occurred relative to the timing of when the animal was pulled. Okay, and so that what you see here on the left side of your screen is the histogram with the days relative to being pulled by the pin rider on the x-axis, the y-axis being the number of first treatments. If we put that into table format, what you see is that this ranged anywhere from seeing animals, alerting animals anywhere from minus 40 days, okay, to 30 days after they were pulled. Okay. Again, remember back on a previous slide where we were discussing how these two BRD and non-BRD populations cross over and overlap, right? And so we are pulling animals that are truly ill, but also animals that are not ill. What we may be seeing is that we are capturing a lot of animals by the time they get pulled have been sick for several days, if not maybe several weeks, ebbing and flowing over time. And it could be that when those animals are getting pulled by the pin rider, perhaps we're pulling those animals for something that is non-BRD related, and they don't actually develop BRD until then, right? But on average, we were relative to the pin rider. The quantified ag technology was identifying these animals roughly 2 days before, 2 to 2.5 days before the pin rider would pull these animals. Labor is one thing that we haven't spoke a lot about. Regardless of the day of the week, regardless of the site you go to, regardless of the class of cattle that you go to, right? Labor is a tremendous issue, and in some cases, the rate limiting step. And in some cases, is higher on the importance level than health or performance of the animals at that site. That they just don't have the labor pool to pick from that allows them to get the day-to-day operation stuff done. Okay. And this is one of the value propositions of this technology. What you see on the screen here is just a raw comparison of if we would have used the quantified ag tags, how many pins would we have gone into on any given day? So right now, in our current scenario, with conventional BRD diagnosis, pin riders enter a pin every day to walk every pin looking for sick animals. Okay. Now they're doing other things too. They're getting animals up, getting them moving. They're checking waters and this, that, and the other. But most of that time is spent looking for sick cattle. Okay. What we saw in this study is that we had 14 pins in which these animals were housed. And obviously those pin riders had to enter each of those 14 pins on every day of that study, okay, in all 198 days of this study, okay. If we would have acted by the quantified ag tags alone, on average, not every day, but on average, they would have only had to go to 2 pins to grab cattle. Now, that doesn't mean we would have treated more or we would have treated less. It just would have meant that the time necessary to go find sick cattle was significantly reduced. Okay, it would have made us that much more efficient. Right. So let's talk about the technology specifically. All right. What you see on the screen here is a picture of what the current tag looks like. This tag measures animal activity and body temperature, all of that data being collected at multiple times throughout the day. Like Whisper on Arrival, it uses artificial intelligence to determine whether or not this animal is different than how it was in the last several days, but also is it different compared to the group, right? And so we're comparing this animal not only to itself, but we're comparing it to the group. Okay, and so this particular technology uses activity and temperature to do that. It has a 2-year battery life, and so we do see it being a reusable tag. And in our commercial plan is hinging on that. It is applied, although it looks different. It is applied in a standard way of tagging. We'll talk about that here in a moment. So it takes an all-flex pin. That pin is inserted right here in the strap, and it passes through this channel right here. We'll talk about the read range here in a moment. But basically, we are targeting backgrounders and feedlots exclusively. Depending upon the size of the operation, the stocker segment may fall into here. We can talk more about that. If once an animal is alerted and that report is sent, there is a light that will automatically come on these tags that allows the caretaker to find that animal easily within a pen. And then after a few hours, that light will automatically go off. There's nothing that the user has to do to turn that light off. Just another picture of the tag here with the all-flex pin in it. Again, utilizes a very similar method of pinning here. The tagger, admittedly, is modified to fit the form factor of the tag. But again, it's applied in the same manner that a traditional visual ID tag would be, or an EID tag would be for that matter. Just a couple of pictures of what this looks like in the animal. So you can see this tag is placed. It has to go into the animal's left ear. All right. The way in which it's manufactured, it has to go into the animal's left ear. The strap goes over the top side of the ear and then pins down this way. The strap here is necessary to keep this tag from rotating out of the ear because we'll go back a couple slides, the temperature component is captured from this thermistor that is located on this side of the tag. The thermistor works by shooting a beam of light down the animal's ear canal and registering temperature coming off the animal's eardrum. Okay. In a very similar manner where a pediatrician may take the temperature on our children when we take them to the doctor. All right, same thing. So the temperature beam is being shot down here. So we want to avoid this tag rotating out. And so this strap is here. One of your first inclinations is a concern of things getting trapped in here, wire getting through there, getting caught on stuff, what have you. This is actually a design taken from a tag that's utilized that has large market share in Australia. And so there is a great deal of experience behind this kind of form factor. And so taking that into account, we feel very comfortable with where this tag is at. And you can see here that the application process, again, very conventional from that standpoint. The overall installation process and the amount of hardware that goes into the system is relatively minimal. It basically consists of one antenna that has a 2-mile read range, okay? A gateway that connects to the antenna, and then obviously these animals will all be wearing the tag in that left ear that communicates with the antenna. That data goes to the gateway. That gateway pushes it to the cloud. And that's it. What you see here is an antenna here on the right that was mounted on a feed mill during a recent install. Again, this one antenna will cover up to 2 miles in range. What you see here on the right is the same feedlot looking at the same feed mill about a mile away. We're at the farthest point of the feedlot, and we have tags in these animals, and these tags are reading without any problem. Okay. With regard to line of sight, there doesn't have to be perfect line of sight. So geography, although we would have to do all that assessment during the early stages of the install. We generally don't have a lot of problems with buildings or that kind of thing being in the way. All right. What the user will see on any given morning is that they would get a report in their inbox or texted to them that gives them a list of animals and the respective pen that they're in and lot that they're allocated to. We would then have a list of animals that have been flagged by the system for further assessment. The lights on these animals' respective tags will be lit up accordingly, and we basically hand this off to a caretaker. Those individuals go out and get those animals, bring them back to the hospital, treat them accordingly, send them back to their respective pens. Okay. What we have seen in our experience is that admittedly, it does take traditional pen riders, cowboys, hospital doctors, all of them. It takes them a little bit of time to get used to the animals that they're seeing getting pulled because of the fact that we are capturing them early on in the disease phase. These animals don't look like a typical sick calf, okay, admittedly. And not until you get a rectal thermometer in that animal do you begin to get a sense that, hey, this animal is actually ill. And so it's an interesting process to see in those early days, to see these individuals who've been around, who've been doing this for a long time, begin to grow accustomed and in best cases appreciative of the fact that this is finding animals in a much more sensitive fashion than humans can. Despite how good they may be, the bovine is much better than us at concealing the fact that they're sick. And so at the current time, our current value proposition to the customer is hinging largely on that labor efficiency piece, as well as capturing those animals much earlier in the disease phase. We'll be initiating a study comparing the Quantified Ag technology directly to that pen rider starting in January of 2021. But this product will enter the marketplace in 2021 as well. Anecdotally, we have this at multiple sites. We are hearing very good things. Retention on this tag, from what our experience has been, is very similar to what a traditional identification tag would be, or an EID tag. So in that 99% retention, these do stay in. As we talk more, there will be more about how to reuse these tags, how to get them back, when to take them out, this, that, and the other, because that will be a process that early users will have to get used to as well. But all that said, I believe that's my last slide, and I'm ready to take any questions. Thank you.
Thank you, Jason. Thank you, Jason. Harold, I think there are a few questions in the chat box, and you might have some others that you have in hand.
Thanks, Bill. I have to get unmuted here. Yeah, so one of the first questions we had was about reusing the tag and cleaning the tag. How do you disinfect it between animals, and how much disinfection can the tag take, I suppose, is a better way to put it.
Yeah, no, that's a good question. A lot, and we'll be providing all the how-to activities on that, Harold. But ultimately, what that means is that you have to get first and foremost, you have to get your hands on the animal, at some point before they leave your place, and so that's something that's something to take into account there. As far as cleaning goes, it's a relatively straightforward process of hydrogen peroxide and basically leaving them alone. They can go underwater. They can sit underwater. They are certified up to being able to be underwater for a certain amount of time. So that is not an issue. The things that could fall that you would have to replace is the button. Generally, on a typical 8-month turnaround, this thing has a 2 to 2.5 year battery life on it. You can generally get 2 good turns out of one tag. But with a background or a stalker, in theory, you could turn that tag over multiple times, and so that's where it stands. As that tag as a technology becomes cheaper, ultimately, ideally, we'd like for that just to be a throwaway tag. But right now, the cost is somewhat prohibitive to do that, and so reusing it is a means of spreading that initial cost out.
All right. So our next question is, how is this tag better or different than the Fever Tag brand? We see the technology is a little bit different, but they're saying we've certainly had some struggles interpreting the data of Fever Tags. The Fever Tag was providing us. So how is this one different from the Fever Tag?
Yeah, no, that question comes up a lot as well, and so again, most of us on here, possibly all of us, have heard of Fever Tag. It was a tag that has become available within the last decade, measuring animal ear temperature. Okay, and it's capturing it in a different manner, but it's using animal ear temperature. I don't believe it's necessarily using artificial intelligence. It's utilizing body temperature for what it's. So 2 things. One is that this tag is using body temperature and activity combined. And depending upon the situation, it's going to, artificial intelligence is different, is that it's going to float between the two parameters and lean on one or the other, depending upon the state that the animal is in. The other thing that's important to remember is that basically at the end of the day, this software is looking for outliers, and it's looking for outliers not only of the animal itself. So we're looking, what's this animal look like today compared to yesterday, for example, but also it's looking at what's this animal look like compared to the group. And so the last thing that we want is for an entire pen to be lit up on July 1st just because of heat. And conversely, you don't want a pasture full of steers lighting up that are on fescue in August, right? And so it takes into account the entire population dynamics as well as the individual to determine whether or not this animal truly is different, if you will, to itself, what it's looked like before, as well as to the group.
So another question is, what is the capacity of one reader and an approximate cost?
Yep. So one reader, get this right, one reader can, we're somewhere in the order of 30 to 40,000 animals on one reader. That read range has a distance of roughly 2 miles. And so we can cover a relatively large amount of area with relatively small amount of hardware. I'm surprised that wasn't the first question, honestly. Right now we're looking somewhere in that $7 to $8 range. Again, that can be the more times you turn that over, the smaller that number will be. And so, that's what we're looking at again over time. We hope to be able to reduce that even more as the technology becomes cheaper.
So the next question is, can the user turn up or down the illness detection level?
Yes. So, well, the answer is yes. Be turned up or down. Right now, whether or not the user will have ability to do that is probably no right out of the gate. But again, with the phone call, we can change those. That's a great question because as we talked about earlier, the at least the perceived risk of disease is going to vary from lot to lot. To piggyback on top of that, the one thing that we are looking in addition, in parallel to all of this, we talked in the first hour about whisper on arrival. And now we're talking about quantified ag. So we're asking two different questions with those two technologies. That being said, what we are looking at in parallel is that can we use the whisper on arrival data to then turn the dial at the individual animal level based upon that whisper profile? So right now, to the question that's been asked here, the algorithm is applied to the pen so that every animal within a pen is set at the same threshold. Okay. But it's just like metaphylaxis. Some need to be at that threshold, some don't. Some need metaphylaxis, some don't. And so what we're looking at right now is, can we combine both of these technologies and use the whisper on arrival technology, not only to say, do they need metaphylaxis or not, but then use that information to then inform the quantified ag technology and turn the dial at the individual animal level so that we flag the animals early that need it and we turn the knob down on the animals that don't need to be pulled.
So another question I've got is, so a lot of places institute a post-trip.
Yes.
Is the tag going to pick that up, or is the tag going to just, okay, this animal is flaring up fever, or identifying that animal as sick, even though it's after it's been treated?
Yeah.
Is there any
No
program with treatment interval? Would be my question.
Yeah, for both PMIs and PTIs, Harold. So we can customize when those flags start based upon the regimen put in place by the veterinarian. And so let's say, for example, we've got a three-day PMI. They won't start seeing alerts until 72 hours after those animals have been processed. Okay. Same thing on the treatment side. Okay, and so all that will be customized to the user's production system.
Okay, so one more question is on animal size. Does that tend to make a difference, like dairy calves in a robot feeding barn?
Yeah, that's a great question. And so, admittedly, we have very little experience on the dairy calf side, but we are working in that right now. In fact, we have a system up in a calf ranch up in southern Minnesota. We're seeing very good results in that situation. Again, we're admittedly very green in that area because those animals, are obviously very confined. We didn't know, how the algorithm would deal with that. But again, we are capturing animals early in disease. They are responding to therapy, and again, they do look different because we are capturing them a bit early. But it does appear to be able to be extrapolated rather to that dairy calf. At least the early data would suggest that.